afternoon. Hope you all had a great Thanksgiving weekend. Okay, nice to see some more folks joining. No, I think just in the interest of time, it is a busy Tuesday, I guess it is. We'll get started and then people can join as we go here. But just wanted to say welcome. Good afternoon, everyone. My name is Carly Gao, and I'm part of the Change Management and Adoption team at Canada Health Infoway. I'm located in Vancouver, BC, and I'm pleased to be your moderator for today's session. So thanks for joining for this Community of Learning webinar as part of Infoway's AI Scribe program. Today's session is on empathia in practice and has been informed by common questions that the Doctors of BC team has seen from across BC. So this Community of Learning series is all about supporting clinicians as they adopt AI scribes in their day-to-day practice. And over the coming sessions, we'll be hearing not only from vendors, but from clinicians themselves to help build shared learning across the province. So for today's part one session, the Empathia team here will be walking us through the essentials of their AI Scribe tool, including how it can help simplify note-taking, some key features to get the most out of the tool, and some quick troubleshooting tips as well. So just before we jump in, I've got a few housekeeping notes. After the presentation by Empathia, we'll open the floor to questions. So please feel free to submit your questions at any time using the Q&A function. I'll be monitoring those, and I think Helen will as well. So we'll address those after the presentation. And if we do have time towards the end of the session, I'll be sharing a few quick polling questions, which is a good chance for you to share your feedback and thoughts as well. And finally, the session is being recorded, so if you have to jump early or if you'd like to share it with some of your colleagues, I'll be sending it after the webinar. So with that, let's get started. I'm pleased to pass it over to the Empathia team, and I want to introduce Nima as well as Helen. So I'll pass it over to you guys to share your screen.
Thanks, Carly. Thanks for the introduction and for the invite to get to showcase our tool to the Doctors of BC and the extended Infoway audience today. Before we jump into the demo, just like to start with a little lighthearted note, and my colleague Helen will also kind of talk you through this a little bit.
Hi, everyone. Thanks for joining us today. Purnima and I are both based in BC. We can see, we've probably met with some of you on this call, either in person or a Zoom before in the past. And we just thought we would start the call with a fun little trivia about how many patient encounters has the most active Empathia family physician recorded so far. So that's how many notes have been recorded so far. So you can put your answers into the webinar chat. A few hints. They've been using Empathia since December 2023, and I'll add it's in the thousands. And then the closest winner will announce at the end for a Lululemon backpack. So that's kind of how we wanted to start it off, with a note of fun, and then we'll get into the demo.
I like how optimistic the responses are already starting to come in.
Yes. It's fun.
I'll give that a minute and we'll jump in. So as everyone's typing in their responses, I just wanted to mention, I know that there are a few registrants for this webinar who haven't had a chance to explore the platform yet, or for whatever reason haven't had the support that they needed to explore the platform. So I just wanted to mention that the first place that you would start is by logging into care.empathia.ai. And there are 3 different platforms on which our product is supported. The center one that you see, that's the web physician portal. That's the most commonly used one. And that is the one that I'll be showcasing today for the ease of the demo. But the platform is also available as a mobile app, both on Android and iOS platforms. And we also have a Chrome extension that physicians like to use alongside EMRs. And we'll get into the EMR integration towards the end of the talk. But I just wanted to highlight that the different platforms that Empathia is available on. All right, let's jump into the demo. So once you log into care.empathia.ai and you create an account, this is the web portal that you will come across. Right now, this is my demo account, so there's a lot of things going on. But if you are logging in without a lot of encounters, the first step that you would like to do is click on New Encounter. This is where you would start to record a conversation with a patient that you're going to see. And I know that this recording panel seems to have a lot of information that you need to click in. I just want to highlight that all these fields are optional. The main things that I would want a physician to focus on is adding the patient name and this big bright blue start recording button. So what this does is helps you keep track of your patients as you're going through your day. Maybe you have 20 to 30 or upwards of that patients that you're seeing in a day. So at least entering the patient's name or initials will help you find the final note at the end of the day. The other options that are available are adding a patient's pronoun, selecting a visit type, or even adding a template. As it is mentioned here, it is optional and it is not required. This text box is for you to add any patient-related contextual information. So whether it is lab results, whether it's any observations that you do not want to speak out during the encounter, any referral information that you have can be simply copy-pasted into this visit context field. And once that's entered, or even during your encounter, you can keep entering information in this little text box. I wanted to also bring your attention to these 2 options here, the patient handout and the referral letter. For family physicians, we find that a lot of clinicians like to give their patients an after-visit summary or some kind of handout to take home after the visit to kind of review the conversation or all of the information that has been given to them. So by clicking on this little checkbox here, a patient handout will be auto-generated once your encounter is complete. Similarly, a referral letter can also be auto-generated depending on the context of your conversation once your encounter is complete. So these are the different little settings that you have on your recording modal. Once your patient is in the room, you can click on Start Recording and have a conversation as usual. And you can either verbalize your findings in your physical exam, or you can also speak out your recommendations or the treatment plan as you're discussing, and all that information will be captured directly by the AI. So I'm going to discard this recording here because there was no medical information discussed. I would like to show you a sample note that was generated after a demo conversation between a patient and a physician about diabetes and hypertension, where they talk about diet and labs and things like that. So this is a sample SOAP note that is generated after the conversation is recorded. So as you see, there are different sections in the subjective. The vital signs are captured in the objective section. This is an example of how the physical examination will be captured if it was verbalized during the patient encounter. And any previous test results, if you had entered it into your notepad, into your visit context text field, can be also captured. And this is how the assessment and plan will show up in a sample note. Now, the output of this note can be determined by a variety of different factors. If you haven't made any personalization settings or updates to your platform, the default settings, you can find them here on the left-hand side in the window in this Note Style tab. So what Empathia does is when you sign up as a family physician or a nurse practitioner, these settings are set to default based on existing community preferences. So we have evaluated the most common settings for family physicians, most common settings for nurse practitioners, most common settings for different specialists, and these are set as default based on that analysis. And that's how you will get that note output when you first start a recording. I highly recommend for everyone to go back into these settings to review them and change them based on your preferences. Currently, my note settings are set to be concise in point form, and the assessment and plan, as you can see down here, is separated into two separate sections. So the problems will appear under the assessment as a list of different diagnoses along with the ICD code. And the plan will appear as a separate section with the relevant recommendations or treatment plan that was reviewed for each of the diagnoses in the problem section. There's another section here called Note Settings, where you can select the ICD code type, and you can also select other options like whether you want the patient handout to be generated by default at every single encounter, or you would like to select as needed. So this gives you a general overview of how to start a new patient encounter, where to review your note settings, and what this note will look like when you first get started. Now, of course, this note style may not be according to everyone's personal preferences, and we realize that editing the note or customizing the note is key to satisfaction with any AI Scribe platform. So we have a lot of different ways that you can personalize your note, one of which I already mentioned was the note style. Another powerful setting is, or another powerful tool that I would like to highlight today is this little purple magic wand called the Smart Edit. So let's say that you do not want the subjective section to be broken down into subsections. So all you need to do is click on the mic button and say combine subsections of subjective into one paragraph. And that's basically instructing the, I have to click on mic buttons. And there is an instruction to the system to modify the note. And what that does is instantly gives you an alternate version of what the note would look like. And you take a look at this and then you say, oh, but I don't want it in a paragraph style. That's not what I meant. I want it in a point form. Change subjective to point form. And that will again update the final result to give it in a point form, but without the individual sections. So as you can see, Smart Edit is a good way to make quick changes to your note. You can change for style. You can add instructions like change the patient's name, or maybe it has assumed that the gender is male when the patient is actually female. So you can instruct the system to change the pronouns. So a lot of different simple personalizations can be done from this tool. And once you are happy with the output, you can save it as a custom instruction. So you can add a custom instruction and apply to all future notes if you are happy with the output of the smart edit. This is a way to train the AI to learn your personal style and personal preferences. And it's not something that you would have to do every single time. This is more for the initial users who are just training the AI how to customize the notes. So this is a second way. So we talked about personalization settings. We talked about smart edit. I would like to highlight templates. Templates, I know a lot of family physicians have existing templates and macros within their own EMRs, and they're familiar with the concept of templates. The templates in Empathia essentially help provide structure to your note. I'll first show you an example of what a template looks like, and then we can walk through how to create one. So let's say I'm looking for a soap template. So this is an example of a SOAP template where the assessment and plan is combined. I'm just going to zoom in my screen so everybody can see. So the system has basically created an instruction for each of the different sections. What kind of information needs to be captured in each section. And there's also an example of what a combined assessment and plan would look like, where there is the diagnosis, a brief description of the diagnosis, and the associated treatment plan right there in one section. So this is what a template does, is basically gives instructions how to structure your note. Let me go back to another example of a SOAP note. Here is another variation, again, another family medicine physician who wanted a more detailed description of the HPI and wanted a separate section for the current medications, a detailed section for the investigations, and wanted a separate section at the end of the assessment plan for the billing code, and a consent note at the end of the template to say that consent was gathered from the patient for using the AI Scribe. So the purpose of showing these two templates is to demonstrate the wide variation in instructions that you can give to the platform on how you want your note structured. And this is highly customizable. And once this template is created, you can set it as default by going in here, and that will be applied to all of your encounters, and you do not have to select a template or take any further action going forward. Now let's talk about how to create a template. Ideally, the first place to start is by looking in the community. We have a very active community of physicians who contribute to these templates. You can look for a specific condition, and you can find templates, notes related to that. You can browse based on who has contributed these templates if you are familiar with any of these physicians. Or if you don't want to be limited by the specialty, you can just even look for mental health or psychiatry type templates, and you will be able to search from our entire community of templates available for different specialists, not just limited to family physicians. So that's one way of getting started with creating a template, that is importing something from the community that already exists. If you want to create your own template yourself, you would click on this button up here that says Create New Template. And there are two different ways of creating one. Either you can upload a sample note, that is a patient note, can be a PDF file or text file or a doc file to upload the sample. Or you can simply copy paste an existing template from your EMR. You can copy paste an existing note from your EMR. You can remove the patient identifiers and just keep the structure of the note intact, so that that will help our system create the template. If you scroll down here, you will see that there is a note type for this template. So what that means is Empathia allows you to create a template for any different kind of note that you would like to generate. So this is not limited to just the SOAP note. You can create templates for the patient handout that you want to send out. You can create a template for a referral letter. And there's also a supplementary note type template that you can use for writing a sick letter for a patient at the end of a visit, or to write a medical justification letter, or any other type of document that you would like to create using our platform. Okay, so that's our third way of editing a note. So we went over note settings, smart edit, and templates. And last but not the least, there is the option to actually type in and edit your note. You can also insert a cursor somewhere and click on this little mic icon. Let me go back one step because I realize I did that pretty quick. In this panel of icons here, there is a button that says Edit All Note, and that's where you click on to start either typing your edits, or you can click on the mic icon to capture a dictation of your edits, so you do not have to type in extra information, and that will appear here directly within the note. The benefit of doing these edits directly on Empathia is that in the background, there is a learn your style feature that is running. And what that does is that although you are not explicitly instructing the AI that I would like the objective to be structured a certain way, or I would like certain information to be included in this section, it is learning in the background the different information that you're adding in to the edited note. So if you were to edit on your EMR directly, that learning or the training for the AI would be lost. That's why we again recommend that you do the edits within Empathia before you copy over your note to your EMR. I know I'm going over a lot of information, but I'm just going to keep with the pace so that we can be on track for time. All right, so you have the SOAP note ready. The patient handout was auto-generated because you checked that little checkbox prior to your recording. Say you want to generate some kind of referral letters or supplementary notes, as we were talking about. We just click on this little drop-down arrow to the right side of your SOAP note and select the type of additional note you want to create. Now, often there might be some template that you have created for a referral letter. Again, if not, you can just click confirm and it will use Empathia's pre-existing template to create a referral letter. Now, in this situation, since we talked about hypertension and diabetes, the referral letter that has been auto-generated is for a dietitian. There was no specific mention of a referral to a specialist in this letter, in this note. Therefore, the AI assumed this role. However, if you specifically mention that, hey, Randy, I'm going to send your referral to dietitian, or I'm going to send your referral to a cardiologist to follow up on certain issues, then it will pick up that information and add the physician's information as well while generating that referral letter. I was mentioning a sick note that you can generate using the supplementary note feature. So in this situation, I have created a template for a sick note, and it will use that to generate the output. And it's very basic and simple. It just states what date the patient was examined on, how long the patient will need to be absent from work, and what is the rationale. I'm just taking a look at my questions here. One of the optional templates, how do I make it stop choosing the templates? So it sounds like it's auto-populating something from here. We have noticed that issue come up a couple of times when recording from the app. So if you're recording on the app and you notice that something is being auto-populated, let me see if I can pull that up really quick. Give me just a second. I know this is a little bit of a segue, but I'll answer that because I know this has happened. So if the template is auto-populating here on the app, you will need to undo it just once, and then it will remember your preference going forward. But if this issue is occurring on a different platform and not the app, just let it know, then we will probably attend to it separately. All right, so we talked about the different ways of editing. We talked about the additional notes that can be created. Helen, is there a follow-up comment?
I just wanted to say there's another question about how can you make a template default?
Okay, let me show. So if you go to, on the left-hand side to your templates, and you select the template that you want to use as default, you can click this little sliding button to set it as default. You can only set one default note for a type, so I can't select multiple SOAP notes as default, but I can select one SOAP note, one consult letter, and one supplementary note as default. So that's how you can apply those settings. All right, let me take a look. Okay. The easiest way to copy it into your EMR is to click on this copy all button. We also have the option to copy as plain text. We released this feature maybe about 3 months ago to reduce some of the formatting issues that have been occurring. So the copy as plain text button will maintain your spacing between paragraphs. It will maintain the dashes and bullets. It will maintain the different subsections. The only thing that the copy as plain text will not maintain is the bold formatting, because again, bold is the rich text. But the copy as plain text we have found works really well with several EMRs to resolve the different formatting issues that have been brought forward by our users. Okay, so this is a quick overview of the web portal. I just wanted to highlight the key features from our different platforms. So the Chrome extension, this is what it looks like. It will open alongside any other platform, any other web page that you are browsing. So if this was your EMR that you're looking at, you can look at your patient chart, you can look up the different labs, and you can go back and forth between your Chrome extension and your EMR to help with the patient review. The other one that we have available is the phone app. And one of the key features on our phone app is the Telemed app. So this, let me just go back to my presentation really quick. And okay. So this is a recording of how the Telemed app on the phone works. You have the option to set your clinic number as the caller ID. What that does is it shows the patient your clinic number as the caller ID. If you do not set that caller ID, your default is set to Empathia's Canadian phone number. So in any situation, whether you set a caller ID or not, your personal phone number will not be revealed to the patient when you use this feature on the app. So I just want to highlight that. You can set your caller ID to a clinic number, which has a phone tree as well. And if you have any issues with getting that set up, you can definitely reach out to us. Once your caller ID is set up, you can enter the patient's details and you can enter the patient's phone number to make the call to them. And what this does is, along with the phone call, it will record the conversation so that a note will be generated immediately after your phone call is complete. We have the option to cancel an encounter in the situation that the patient doesn't answer the phone, it goes to voicemail, or for whatever reason, the patient does not consent to using an AI scribe. So if you cancel the encounter, it will stop recording the conversation, but you can still continue with the phone call, so you don't have to hang up and call that patient back again. And we have also included a new feature to review your most recent dialed numbers. So this little button at the top will show you your most recently dialed phone numbers. So like in the previous example, the patient doesn't answer the call, you need to call them back. You can just quickly go to your recently dialed lists and call the patient again. So this was a quick overview of the Chrome extension and the app. And I wanted to just quickly highlight some new updates that we have on the platform. There's a big bright green button that's visible here that's called Telemed on the web. So similar to the app, we now have the Telemed functionality on the web app as well. And if you have already done the caller ID setup on your app, you do not have to redo it. And your caller ID will be shown here. You can also record from another telehealth platform that you're using this record from other platform or screen share method, and it will capture the audio. It will not capture the video, so that, again, a transcript is generated and a note is generated at the end of your call. Another new feature that has been highly requested and used quite a bit by our physician community is the form fill, the autofill form fill. And if you see here, we have quite a few forms from BC that are available on our platform. The first thing that you can do is preview if this is the appropriate form that you need to use, and you save it to your library. And once that's in your personal folder, you can fill it out using a test encounter. Or the ideal workflow is you see a patient, your note is complete, and you want to fill up this requisition form or any other form after the patient encounter is complete. So you pick that form from your patient encounter, click on Start Autofill, and that's the process to get the form filled. There's one more that I wanted to highlight. We're getting close to the time. Is the patient profile feature. So when I type a patient name in here, it shows me the most recent matches for that name. And when I click on any of these names, what it does is it pulls up, okay, it didn't have one for this one. I'm not picking the right encounters, I guess. Ideally, what this would do is Jake. There we go. It picks up the most recent SOAP note for this patient. The goal of having this feature is to reduce the switching of back and forth, reduce the context switch between Empathia and your EMR. So if you type in the patient name, you can easily review the most recent SOAP note, what the patient was there for, what was discussed, what treatment options, what procedure was performed. You can review all of that information directly within Empathia. You can add in some notes, some updates in this other visit context field here and start recording. So this patient profile feature is available on all platforms, and it is also available if you are trying to record from the Telemed app. I've been speaking for quite long. I've talked about most of our recent features. Yes, EMR integrations, just quick 5 minutes on that.
Just before you do, quickly,
Yes.
Purnima, there's just a couple of comments, and I see that, Helen, you're addressing the first one by email, which is great, but there was one other comment. The Telemed button on Chrome is not loading history when I type a name in an encounter like it does on the phone. So any advice around that?
Yes, the Telemed on, let me read it a little bit better. Telemed button on Chrome. Yes. So the Telemed on web is a new feature, and we're working on making sure that all of the existing functionalities are being updated. Yes, thank you for bringing that to our attention. We'll release that in pretty shortly. But it's good to hear that people actually know of this feature and are actively using it. Was there any other question? Okay. So I just wanted to quickly highlight a couple of EMR integrations that are at the API level that we have. We have recently launched our Accuro integration. As you can see, this is available, not on this. There we go. The Accuro integration with Empathia is live. Physicians who are using Accuro EMR can apply for the integration through their Accuro customer success team. And once that request is processed, you'll be able to integrate it directly on your Empathia platform. The benefit of this Accuro integration is that it's a two-way API level integration, and it allows you to synchronize your schedule from your EMR. So you will see the same list of patients in your Empathia at the start of the day, and you can directly record on those appointments, and you can send the notes back to Accuro, to the relevant patient file, without again having to switch contexts back and forth. So that's the Accuro API level integration that's already live. We have the existing integration with Oscar, where we have the recording modal directly within the patient chart. So this has been live for more than a year. We have quite a few Oscar users who already have this integration. And again, same thing, you can directly start recording on the patient chart, and you can, once the note is ready, you can push it directly to the patient chart directly in Oscar. And I also wanted to mention that our Chrome extension has this little, has a little Emma icon, which allows you to autofill a form. For some reason, I'm logged out here. Oh, there we go. The Toolkit has an autofill function, And what this does is, if your EMR does not have an API level integration with Empathia, our Chrome extension still allows you to fill up relevant fields in your EMR using this autofill function on the Chrome extension. So currently we have users who have tested it out with Plexia, but if you have a different EMR and you would like to test it out, if you need any assistance, please feel free to reach out to us. And with that, I will pause for questions. Thank you, everybody, for your patience.
There was
Thank
one.
you so much for that very informative session. We appreciate it.
Thank you. Yes, Helen.
There was just one more question regarding the Juno EMR integration as well, and how that's if that's a similar workflow to Oscar.
Will you be getting that direct recording integration for Juno EMR since it is Oscar based? I know that we do have a few requests for Juno EMR. So what we are doing is directly contacting the EMRs based on requests that we have gotten from physicians, because EMRs always ask us to give us a list of physicians who are actually requesting this integration to kind of justify it. So yes, it is in the works, and it'll be coming soon.
Great. Now we'll open the floor. If anyone has any other questions, now's the time. Feel free to please enter them in the chat or in the Q&A and we'll address them.
I'm just going to keep this up on the screen till people start typing their questions.
Perfect. There is one more. So how do I get Empathia to transcribe social history? Patient's occupation tends to be omitted.
So that's a really good question. Thank you for asking. One of the ways to make sure that your note includes the patient occupation is either to go to your settings and make sure that none of this has been kind of removed accidentally when you were playing around with settings or something. If any of the social history or any of that was removed from your settings, make sure that is not the case. If you find that still it's not including the social history or the occupations, I would suggest using Smart Edit. So if you go into the specific note, use this purple wand button and add the instruction to always include the patient's social history, include patient's social history, including occupation. That's all I can think of right now. So you could add that as a smart edit and then save that as a custom instruction. Probably in this note, there will not be anything different, but I don't think that it was captured as part of this conversation. But using the smart edit instruction would be the best way to include that.
Thank you. Are there any more questions? And please feel free to reach out after the session as well if you'd like any other questions addressed, or if you think about them a few days later.
Yeah, I guess that's always the case, that questions always come up when you are trying to do something, you're in the middle of something and there's a question or a issue that happens, and we have a lot of resources. I'll let Helen talk about our community and our support options available.
So I'll quickly just talk about this community icon that you'll see in the left toolbar when you log into Empathia. It'll take you directly to this page on the right, which is really a way in which our users can contribute wish list ideas, things that they're looking for, a really way for us to develop our product to meet the ever advancing needs. There's also ways in which you can ask a question, and one of us will either get back to you or another, family physician might get back to you about their preferred workflow. So we really encourage our users to use this as an additional resource to their Empathia experience.
Awesome. Thank you for sharing.
Yeah, Purnima, maybe you can go to the next slide. I also just wanted to quickly let everyone here know that, you know, Empathia is being used by family physicians, but also, you know, 25 plus specialties across Canada. So we are actively being used right now in hospitals across BC, Richmond, St. Paul's, VGH, and working on a rollout with these respective health authorities that you see here. You know, we've also worked with, I think probably I've seen many of you at divisions events or other society, you know, events like Rural and Remote Physicians of Canada and other such conferences. And then finally, oh, let me see, intra-health EMR. That was a question there. Yes, we are in touch with them and working with our EMRs. You know, if you would like, it's always a great idea to write to your EMR, say we would like that integration with Empathia. That helps us smooth the workflow. So we now integrate with over 10 EMRs, but it was also based on users' feedback and that process happening. So I appreciate that comment. And the last slide here, Purnima, I think there's 2 left, but I wanted to say the trivia answer that we put out before, how many patient encounters has been recorded. So the answer was 14,096. So Dr. Dalal, you are the winner there, and I'll reach out to you as well. Oh, I see the question as well from you. Yes, we integrate with Cerner, Epic, and a version of Meditech. So yes, we are working with larger organizations and hospitals. It's not just that we integrate with those EMRs, but it also has to be that hospital that opens up that site to us to allow that integration to go through. And
Awesome.
maybe the last thing here is just our email is here. So if you would like to book a one-on-one support with our customer success team at any point in the process, you can simply email, you know, I want to book a Zoom demo, and then they will send you a link to a Calendly, which will, and maybe Purnima, you could also put that Calendly in there as well. And you can book at your own convenience. You know, we have evening hours, we have weekend hours. We also have support articles. And then finally, you know, you can just pick up the phone and call us as well. So that's our number there if you ever need issues with support. And I think that's probably it from our team.
Yeah, and I know
Fantastic.
Charlie had some stuff to share, so I'll stop sharing my screen.
Fantastic. Yeah, I think this is a really great segue into I just have a couple of slides to capture some of your feedback as clinicians. But just a note on the support email, I can definitely send that out after the session with the recording too.
Great.
So if I just have 2 more minutes of your attention. Can you see my screen here?
Yes.
Fantastic. So this is a great opportunity for us to get your feedback. And if I could ask you to please enter the responses in the chat, and Helen and Purnima, if you can please just read out the responses if they come in. So 2 questions here. The first one is, what would you like to try next with your AI Scribe if we're looking ahead? And if there's no responses, that's okay, but something to think about.
Autofill forms. Yes, which we
Autofill
showed
forms.
today.
Okay, fantastic. Anything else that you'd like to try next?
That does not exist on the platform is fair too. Telehealth, okay.
Telehealth, great.
Transfer test results automatically when selected. Video call, okay.
Great feedback. Thank you so much. Any other ones? I'll move to the next question. Nope. Okay. So other question is, what additional supports do you need around AI Scribe use and workflow integration? And this can be, you know, feedback for Doctors of BC, for Empathia, or for us at Infoway as well.
in editing, making and editing templates.
Okay, good to know. Can definitely provide some guidance on that.
Speaking to other super users on first tips and ideas.
Okay, that's actually a great feedback, because we will be organizing a part 2 of these Community of Learning series, probably in the new year, that will be led by a clinician champion. So please look for that invite, and I believe we'll be doing it vendor specific, so we can have a super user from Empathia.
Synchronize with more commonly used EMRs. That's a very high on the list of requests for most
Yeah.
physicians.
Okay, fantastic. So just very quickly before we go here, I also wanted to share this slide. So the Doctors of BC, they do have some great supports. They've got some resources and tools already in place for the support of AI Scribe adoption in BC. So if you want to scan this barcode, this will take you to some helpful resources and tools, related to consent, privacy supports, patient resources. So I'll leave this here for a couple seconds. And I can also send out this after the session. Okay. Well, thank you so much, Helen and Purnima. I really appreciate your time. Thanks for that excellent walkthrough. And thank you to everyone for all your participation, for all your questions, and for your time. Hope you have a wonderful day, and we'll talk to you soon. Thank you.
Thank you.
Take care.